The second conference, which focused on participants from Northern, Eastern and Central African regions, enlightened the committee on the impact of COVID-19 on the rise of the number of people living with HIV or AIDS in Africa. Jeanette Sahelmji, the chairperson of the HIV committee of the APHCR, highlighted that they had extensive deliberations and came up with recommendations for member states regarding those living with HIV and AIDS.
I would call on member states to establish adequate funds and to fund institutions and mechanisms that provide oversight services to people living with HIV, AIDS and key populations. We call on member states to mobilize domestic resources through a strengthened tax system, address illicit financial flows, and invest transparently and efficiently in strengthening the national health system and service delivery. This conference also called on member states to integrate HIV financing into the national budget to ensure sustainable, equitable, effective, and efficient resourcing and spending on HIV programs and services, together with so many recommendations that we have for member states.
The Committee on HIV also sought to draw on lessons learned from the HIV response in order to contribute to ongoing conversations on building resilience against further pandemics and other global health and development challenges. Dr. Theoben Kandetu, who represented Namibia at the event, emphasized on inequality and closing the gap between those infected with HIV and those who are not.
Meaningful and measurable involvement of civil society, especially people living with HIV and populations most at risk of HIV infection, was also emphasized, in addition to ensuring that programs are based on human rights and gender equality, as well as harnessing new technologies to promote local production of medical countermeasures, including medicines, and investing in research and innovation to develop vaccines.
Ndapewa Ambambi, NBC News, Fintuk.